Hi, Ms. Higgins. My name is Bridget, and I'm going to be your nurse today. I am here to do an assessment of your abdominal area. I would have already asked the patient to empty her bladder before the assessment and to get undressed and drape the patient for privacy. Ms. Higgins, I'm going to assess your abdomen using look, touch, and listen. If at any time you feel any pain, any discomfort, any tenderness, please stop me. Okay, let me know. So the first thing I'm going to do is just inspect your abdomen. I am looking for any discoloration, any bruising, any rashes or moles, lesions, any wounds, any dilated veins. Also looking for any scars. If there were scars present, I would note their location, their length, and their coloration, as well as if there's any keloid formation. So I'm going to inspect the umbilical area, looking for any bruising around that area or herniations. Don't see anything. I'm looking to see the contour of the umbilicus, whether it is inverted or protruding. It's inverted, but if it had been protruding, I would expect it to be no more than 1/2 centimeter. I'm observing for any aortic pulsations, and if they are visible, then I would expect them to be very slight and gentle. I don't see any at all. I'm looking for any peristaltic waves, which should not be present, and there are none present at this time. I'm assessing for abdominal symmetry. Flank area for any bruising. I don't see any bruising on the flank area. I'm going to measure the girth of the abdomen. Can you roll towards me just a little? Okay, and come back. Roll that way just a little. Okay, good. And I'm just going to go ahead and bring the tape around and measure the girth of the abdomen at the umbilicus. I'm going to look at about just above eye level. I'm going to look at the contour of the abdomen to see whether it's flat or rounded or scaphoid. Her abdomen is flat. Now I'm going to auscultate her abdomen to listen for sounds. I'm just going to place my stethoscope. It's going to be warmed over certain areas to listen for different sounds in different areas. First, I'm going to use the diaphragm of the stethoscope and listen to bowel sounds in each quadrant, starting at the right lower. And what I'm listening for are just gentle gurgles or clicks that occur. They should occur roughly every 5 to 15 seconds. And I'm going to listen for at least a minute in each quadrant. Okay. I'm going to assess whether her bowel sounds are hyperactive or hypoactive. And if I note that no bowel sounds are present after a minute, then I would go ahead and listen for a minimum of 5 minutes before I could accurately say that the bowel sounds are absent. Bell of the diaphragm. To listen for vascular sounds, I would expect to hear a bruit over the abdominal aorta, over the renal arteries, over the iliac arteries, and then over the femoral arteries. And again, I would listen against bare skin, not through clothing or drapes. I would listen for venous rub, over a venous hum over the epigastrum, and that's not present, and over the umbilicus. No venous hum. Finally, I would listen to over your liver for a friction rub, which should not be present, and over the spleen for friction rub, again, not present. Called percussion. I'm going to place my hand against your skin, and I'm going to gently tap with the fingers on the other hand against my fingers to listen for the sound that's produced. If at any time you feel pain or discomfort, please let me know and I'll stop. So first, I'm going to percuss over all 4 quadrants, listening for the sounds that's produced, and I would expect to hear tympany over hollow, air-filled organs such as the stomach or the bladder or the intestines. And I would expect to hear dullness over solid organs like the liver and the spleen. Okay? Okay. So that all sounded fine. I would be listening for any abnormal dullness in areas that it shouldn't be, which would indicate either fluid or a mass, and I didn't hear any of that. So then I'm going to percuss the liver to assess the span of the liver or size of the liver. And I'm going to start in the right lower quadrant and move my way up along the mid-axillary line and listen for when the sound changes from tympanic to dull and mark that area. And then I would start right upper chest, mid-clavicular line, and move downward, listening for the change from tympanic to dull, and that would be the upper border of the liver. And then I would measure the distance, and it should be no more than 8 to 12 centimeters, which it is, it's normal. I would repeat this process at the mid-sternal line, starting below, and listen for the sound change to indicate the lower border. And then again, start upper and move down to listen for the upper border and mark that spot. And then measure, and in this location, it should be 4 to 8 centimeters, which it is. Next, I'm going to percuss the spleen, which is in the left, just posterior to mid-axillary line. And I'm going to start low and move upwards, listening for the change in sound. And I'll mark that spot. And then start higher and percuss downward to listen for the upper border. And mark that spot. And when I measure this area, it should be no more than 7 centimeters. So far everything's looking okay. Any pain? Next I'm going to percuss your kidneys, but I'm going to put my hand over and hit with my other hand. If at any time you feel pain, tenderness, discomfort, let me know, okay? Just sit up. Okay, so I'm going to put my hand at the level of the 12th rib at the costovertebral ankle and strike. I expect to hear dull sounds on each side with no pain, no discomfort. Still good? Mm-hmm. Okay. All right. Finally, the last technique I'm going to use is palpation, where I just press and feel certain areas of your abdominal area. Let me know if there's any pain in it. Feel all 4 quadrants, checking for tenderness or feeling for muscular resistance. I don't feel anything, no pain with that.
No.
Okay, next I'm going to do deep percussion with 2 hands. Push it a little bit deeper, delineating organs and feeling for masses. Any pain?
No.
Okay. I didn't feel any masses. Had I felt any masses, then I would want to note its location, its size, its shape, the consistency, whether it is pulsatile or whether it is movable. And I didn't feel any masses, everything feels normal. So then I would check for rebound tenderness. So I'm going to press, and when I release, tell me if you feel pain upon release.
No.
Okay.
No. No.
Okay.
No.
Okay, so that's good. That's all normal. I'm going to palpate around the umbilicus to feel for any masses or herniations. Don't feel anything abnormal there. I'm going to palpate the abdominal aortic area to feel for width and to feel how strong the pulsations are. They should be gentle pulsations, and there shouldn't be any extra widening. Okay. I'm going to palpate your liver. I'm going to put a hand underneath, and then I'm going to feel along the right costal margin. Take a deep breath. I'm going to press inward and upward. I'm feeling for any masses, any rigidity, any enlargement. Didn't feel anything like that. Again, feel your spleen area. I'm going to put my hand under here and lift. Take a deep breath. Pushing inward and upward. Feeling if the spleen is enlarged, and I don't feel anything. Now I'm going to feel the kidneys for enlargement or masses. Okay. And then once over on this side. And everything feels normal. Any pain or tenderness?
No.
Okay. If I were suspicious of ascites on this patient, then I could assess for shifting dullness, or I could do a fluid wave test, but I don't suspect that she has any ascites. Finally, I'm going to palpate her bladder. She has already emptied her bladder before the assessment, so I'm just going to start at the pubic symphysis, and I'm going to move upward toward the umbilicus and outward, feeling for bladder distension. Any pain with that?
No.
Okay, so this concludes the abdominal assessment.